myself Dr. Swapnil. I am a private practitioner. So I'm going to talk on community ophthalmology and private practice are mutually exclusive. So actually private practice, I'm talking more about the private practice, why it is better than community ophthalmology. Because there is a business autonomy. Private practice provides an opportunity for practitioners to have greater control over business aspect of work, including scheduling, pricing, and the overall patient experience. Other thing is there are technological advancements because as a private practitioner, we have flexibility to invest in latest technology and equipments. And thereby it enables us to stay at forefront in advancements. Patient-centered approach. As a private practitioner, we have ample of time to have a personalized approach to patient care, and we can give individualized attention for each and every patient. Thereby, the quality of treatment is much better. Financial independence. Private practice leads to financial independence by potential for higher earnings, and ophthalmologists have freedom to set their free structure. Balancing work-life. As a private practitioner, we can select the number of patients and the number of patients, number of surgeries, and the time planning we can easily do. And by that, there is we have ample time for our hobbies, family, and it is like work satisfaction also. So this is good in private practice. On the other hand, there are challenges in community ophthalmology. Because community ophthalmology is mostly done in the peripheral areas or rural areas, so there is limited access to eye care services because in remote areas and underserved areas to provide the facility is difficult. We may not get the professionals, ophthalmologists and other staff as well. Awareness and education. There is less awareness about the preventable conditions in peripheral areas, and for that we may need to educate the society so that more patients may get the benefit. Infrastructure and resources. In remote areas, it is very difficult to start a community center because of the infrastructure, the road conditions, and the resources which may need. Financial barriers, because community may not afford the quality eye care at the peripheral places. Prevalence of preventable blindness. There is a lot of preventable conditions like cataract and refractive errors which are prevalent in certain communities. Infrastructure and surgical interventions. Infrastructure for cataract surgeries or any other surgeries, say retina surgeries, is difficult in peripheral centers. Getting well-trained ophthalmic personnel like ophthalmologists, optometrists, ophthalmic nurses is also difficult. Thank you.
Thank you so much. I'd like to ask Dr. Gopal Arora to just give his inputs.
Well, thank you, Dr. Rohan and Dr. Swapnil. Both of you have put your points very well. If I have to answer this question, I have to go back to the earlier debate of whether leaders should have or doctors should have work with head or heart. But frankly speaking, if I have to generalize a statement, I would put it like if a private practitioner's curriculum include community ophthalmology as one of the part, that will be a good service to the society. Yeah. Thank you, both of you.
Both have their contexts, and national requirements may require that you fulfill both roles. I mean, both roles are essential for a nation like ours. So, any comments from the audience? One comment on, I think this is an important aspect, private practice and community service. One comment from the audience.
Yes, we need to give back to the society also. Yes.
So, what I believe, so I'm a very young practitioner as well, but from the small experience of practice I started, I realized without the social ophthalmology, it is even difficult to run your private practice if you are starting up. If you have an established big practice, maybe it doesn't make a big difference. And in the part where I come from, maybe Andhra Pradesh, where we have a lot of government schemes which endorses for cataract. So it is funded, the government funds cataract surgeries, phacoemulsification basically. So it makes our life easier as a young practitioner.
So as part of developing your reach to people, also community service may be needed, but at the same time, it is our obligation to the community in a country where a large segment of population is still underserved, that probably that must coexist with the best of services in private sector and government sector also at the same time. Community service will remain a need. So let's go on to the next.
Thank you so much.